Welcome back. We're diving into hormone therapy and navigating perimenopause and menopause. Joining me now is our women's health expert, Dr. Tatiana Saavedra, here to break down everything that women need to know about their options, the risk, and what's safe and what actually works. Good morning.
Good morning.
Of course, thank you for joining me. Let's jump right in. First off, what exactly is hormone therapy and how does it help during menopause?
So hormone therapy is essentially kind of just like what it sounds. It's trying to replace the hormones that we're seeing that are dropping or kind of erratic over the perimenopause transition, and then certainly once we get into menopause. And so, you know, the two big ones that we have talked about before in the past are going to be estrogen and progesterone. So when we talk about hormone replacement therapy, we're essentially trying to replace those two hormones. And the biggest indications for treatment currently are going to be the vasomotor symptoms. So remember, like the hot flashes and the night sweats. People who are maybe high risk for osteoporosis or fracture risk, so trying to prevent osteoporosis. And then women who suffer from the genitourinary syndrome of menopause.
Gotcha. So let's break this down a little bit for people at home. So when we talk about hormone therapy, are we talking about like the pills, like birth control pills? Is it an injection? Is it a shot? Is it similar to how birth control works? Can you explain more on that?
So that's actually a great segue and a great question. So there are so many different formulations, and it kind of depends on the stage in life that the woman is in. So for a quick example, if you have someone who is perimenopause age, but maybe is still having menstrual cycles and maybe still is within the possibility of being able to get pregnant, then you might offer that person some hormone replacement in the form of birth control. So that could be given in a pill form like we traditionally think about, or if for some reason they're a little bit at higher risk because of other underlying conditions, then maybe something like an intrauterine device and then a low dose estrogen might be a better fit. But there are just many different formulations and many different combinations that are available. So oftentimes it's just very, it is somewhat nuanced, and like we've talked before, it's very much a patient dependent kind of scenario. So
right, I understand it depends on the person.
Yes.
But what's the most common or the most recommended form that people can at least start with and try to research and see if that's for them?
Perfect. That's a great question too. So the ones that I would generally recommend based on the information that's out there, and then also just the data that we have in terms of safety and other things, would be generally oral forms or transdermal.
Gotcha.
So estrogen, we can talk about estrogen real quick. Estrogen comes in a ton of different formulations. Some are oral, some are in a patch form, some are even in cream forms. And so depending on what symptoms you're trying to help alleviate, and whether or not maybe you have underlying like high blood pressure or are a smoker or things like that, the transdermal route might be safer just because it actually tends to get your levels pretty stable and fairly reliable. The oral can do that too, but then you're metabolizing it by the liver, and so that increases risk of clotting and other things. So transdermal probably would be my go-to. And then for progesterone, again, it kind of depends on the situation, but there are oral forms, and then again, potentially intrauterine forms or injection forms too.
So I know you mentioned like smoking being an underlying condition, high blood pressure, but let's talk about someone who's had a major disease or something that's been like super impactful in terms of their health. When we talk about maybe breast cancer, for example, whether they have it or if they're in remission, what's safe, and is this a safe option?
So that is the one place where we don't have a lot of data, unfortunately. I think the push now is to really try to study that population a little bit more, because it's unfortunate, they are going to go through menopause as well.
Right.
And so we would hate for a patient to have a horrible quality of life in terms of having tons of symptoms and then be told you can't get on hormone therapy. There are some options. And it kind of depends on how far out they are from their breast cancer diagnosis and what type of breast cancer it was. So a lot of times those are going to be discussions that need to be had with the oncologist and with whoever maybe is going to be prescribing the hormone therapy. And as with just about anything in medicine, it's always about balancing the risk and the benefit, and just kind of seeing what kind of wins in that tug of war.
Now, really quickly, I have like 2 more questions I want to get through. Now, for confusion out there, anyone who's still trying to weigh the option or weigh and trying to figure out if this is for them, what is the biggest misconception? And then what advice can you give when it comes to figuring out if this is for you?
Okay. I think the biggest misconception is that hormone therapy is not safe. And I think that we were told that for so many years after the Women's Health Initiative came out in the early 2000s. And again, I mean, the problem with that particular study is that when we've gone back and really evaluated it, you have to go back and look and see what were the patients that were included, and does that really kind of comprise the patient population we are talking about now. Right. And then the formulations of the hormones. And what we know is that they were given formulations that we probably wouldn't use today, and they were probably older than patients we would start on hormone therapy. And so I think the misconception that it causes all these issues like blood clots and stroke and breast cancer, yes, risks are there. But in the grand scheme of things, they're very small. And so again, I think the biggest piece of advice I could give to a patient who's thinking about it is talk to your doctor and pose these questions, because it's going to involve the doctor really kind of digging into your history and seeing what your family history is, maybe what your risk factors are, and then sitting down and having a very honest conversation with the patient in terms of, this is the potential risk, but it's fairly small, and we can always start really low on hormone therapy and just see how it works. And this is not something that we would just start and then just kind of be like, okay, we'll see you later. Right. This is something that we're going to follow up pretty regularly to make sure that we're not seeing any complications.
Perfect. That is a lot of great information here. So much to cover in such little time.
It's a lot.
But we're going to put this on Louisiana First News, and if we didn't get to anything that you might be thinking about or wondering, you can always email us at getanswers@louisianafirstnews.com, and we can bring this topic back up and discuss it live with you. Thank you so much, Dr.
Thank you
for joining us this morning. Stay right there, more news, weather, and traffic after the break.